We saw Hims and Hers come out with basically a copycat version of your oral GLP-1. They since have scrapped that pill version, and we saw the FDA come out and move pretty quickly against them. And so to start, I'm curious, were you surprised at just how quickly the FDA acted there?
I was happy. I think that's a better word to use. We have for a long time been discussing how we simply don't understand how this compounding has gotten to the level that it has, mass compounding. When you see Super Bowl commercials, then you basically say this is no longer individualized medication, this is mass compounding, and we have not understood it, and we felt not just on the back of the unsafe API that's coming, and we don't know what is being injected into people's stomach. Also, where did IP go? Intellectual property is the backbone of this industry. It is really, really important that, of course, we're allowed to have the exclusivity to recuperate back the investments. If anyone can bypass the FDA and simply put any product into the market, then the system is broken. And I am very happy to see that both FDA as well as, of course, the reference to the DOJ was swift.
Mm-hmm. Well, Mike, you mentioned IP, and to that point, we're talking on Wednesday, just a couple of days ago, you did file a lawsuit against Hims and Hers for patent infringement here, even though they've scrapped their planned version of your pill. So why proceed with the lawsuit if they no longer have those plans?
The lawsuit is around the semaglutide IP as a whole, not just specifically the pill. And it goes really back to the notion that we believe there should not be mass marketing of compounded products to everyone. I think compounding should be reserved for a few individuals that might have an allergic reaction to our medication, and that would be fine. But I think when it gets into the masses, then I think it needs to be addressed. We also, of course, have really continuously talked about patient safety, and I still believe API coming from unknown sources, often China, without getting the approval from FDA is not a good thing. So it has to be the original API, if anything, and of course, this is something we'll pursue.
And I do want to talk a little bit about the earnings that you did announce last week, because the guide really seemed to surprise Wall Street, and you saw that reaction in shares moving sharply lower. So when it comes to the scope of 2026, I do wonder what the biggest unknown is when it comes to that outlook, either positive or negative, when you think about factors such as your pill uptake, or you think about factors such as Medicare expansion.
I think the biggest unknown is on the volume side. We have said that we're going to grow the volume gradually, and price cuts are happening on day one. And that is why you see the numbers. Of course, the pill has been a phenomenal launch, really a good launch. As of basically today, we have 246,000 people after 5 weeks on the pill. I am very happy with that. But I have to remind you and the audience that the pill starts with zero, while we have more than $30 billion worth of injectable there that got repriced. So while this is going to be, as I've been saying, a year of so-called headwind from a pricing point of view, it's a year of tailwind to come on the volume side, and we have to really work hard to make sure that those volumes materializes, and we're doing that.
Let's talk a little bit more about that dynamic, pricing versus volume, because you've set a price of $149 to start for your pill. Is that the floor, would you anticipate, or would you, perhaps see a situation evolve where you are cutting prices from there?
I think that's a very affordable price right now, and that's where we are at this point. Our pill uptake has been 15 times better than when we launched Wegovy injection. It's been more than twice as good as when Zepbound, our competing product, was launched. So that tells me that that is the right price point to untangle a lot of patients that are right now in need to come and join us. As we go forward, I think pricing in this dynamic world is going to be actually looked upon day by day, week by week, month by month. I think we're in the right place, and now the focus has to be on volume uptake.
Mm-hmm. Well, you mentioned that the launch has been very successful so far. And I have to ask, I mean, when you take a look a few years down the line, I know the hope is that the pill will expand your total addressable market rather than cannibalize the injectables. But could you see the pills, the oral form of your drug, sort of surpassing the market for injectables?
I could see that, but honestly, no one knows. This is unknown territory, and we are ready because this is Wegovy pill. As we have Wegovy injection, we have the same manufacturing site, the same API, raw materials, so we can very easily turn the knob between injection and the pill. So we have the flexibility that I would say give us a competitive advantage. But nevertheless, I basically will wait and see before we claim. Right now, as you said, majority of the people, 90% of the people that are coming towards the pill are new patients, new to GLP-1. So that's actually good because it's expanding the market.
And just to follow up on a point you made that, you can sort of shift here, are you talking specifically about manufacturing when it comes to the pill versus injectables? That's
correct. One of the things I think most people don't know, the pill manufacturing is made in US from the very beginning till the very end. That's quite unusual. Many of our peers produce and have their API come from China. They often use Ireland as a hub to do the filling and the formulations, and then they bring the products into US. Novo Nordisk in North Carolina makes the pill from the scratch, basically. The API is made in North Carolina, the filling and the formulation is done there, packaging is done there, and then of course it goes out from that to US. We export out of US more than we import into US. So that's actually quite unique and something I'm very proud of.
I do also want to talk about the deal landscape, of course, because you were involved with that high-profile bidding war for Metsera. Pfizer ultimately won out there, but you are vocally in the market for a deal here, for an acquisition. And I'm wondering, are you shopping or are you getting approached? What does that look like?
Both.
Yeah.
I would say both. When you have an ambition to go out there and solve the problem of 1 billion people, then you first and foremost look into your own R&D shop and see how we can accelerate and do more. And I'm incredibly proud of our pipeline. But you're also humble enough to say we should not have a not invented here syndrome. We should actually be open to other inventions out there that others have done. So can we go out there and look around? And others also have noticed that from us, are approaching us, and we will basically see when we can complement what has been made outside with what we have made inside and have the best of the two worlds.
And what do you make of valuations at this point, as you do go on this little bit of a shopping trip?
I think no one else better than Novo Nordisk can value basically these assets. This is our bread and butter and something that we understand incredibly well. Metsera was, I think, a very good example. Our initial bid and our last bid was the same number, and that's because we knew what it's worth to us and what it's not. So we have to have the financial discipline to walk away when it's no longer worth, but also have the generosity of putting our hands in the pocket and pay for whatever the worth of an asset is.
And before I let you go, I am curious, do you have any sort of ideal timeline in mind for, when you might see this deal materialize, or is it really just about finding the right target?
No, I think it's finding the right target. I don't give myself a KPI or a target on quantity of the deals. We have to have the right quality deals that matches the overall strategy that we have. So we will continue searching, and when we find the right deal, you'll be the first to know.